tonight. 68 new COVID-19 cases and 2 additional virus-related deaths recorded yesterday, January 19, taking the country's death toll to 331 and total cases to 14,487. Government expected to spend $3 billion to implement Phase 1 of the COVID-19 vaccine program. Still tonight, the Union Gardens and Carimed Foundations donate tablets valued at $2.8 million to students and teachers at the Union Gardens Infant and Evelyn Mitchell Infant Schools.
Everybody, all our students across Jamaica, regardless of where they are, regardless of their economic situation, that they have a device.
And Prime Minister Andrew Holness congratulates President Joseph R. Biden Jr., who was today sworn in as the 46th President of the United States, while Vice President Kamala Harris made history as the first woman to occupy the position. Good evening. Jamaica recorded 68 new cases of COVID-19 and 2 additional virus-related deaths as at yesterday, January 19. Now, this takes the country's death toll to 331 and the total of cases to 14,487. Now, according to the Ministry of Health and Wellness, a 58-year-old woman from Kingston and St. Andrew and a 48-year-old woman from St. Mary are the country's latest fatalities. Of the 68 new cases, there were 29 males and 39 females ranging in age from 2 to 76 years. Kingston and St. Andrew and St. Catherine recorded 15 cases each. Clarendon recorded 9 cases. Manchester, 8 cases. St. Anne and St. James recorded 6 cases each. St. Elizabeth and Westmoreland, 3 cases each. St. Mary recorded 2 cases and Hanover recorded 1 case. The country also recorded 34 recoveries, taking the total of recoveries to 11,777. In other news tonight, the government says it has put measures in place to facilitate the quick clearance of the coronavirus COVID-19 vaccines once they arrive on the island. Minister of Health and Wellness Dr. Christopher Tufton made this disclosure while delivering a statement in the House of Representatives yesterday. The government has committed to vaccinating 16% of the population in Phase 1 and will receive 935,676 doses of the approved COVID-19 vaccines through the World Health Organization's WHO's Vaccine Global Access COVAX facility, with 292,399 doses scheduled to start arriving in April. Now, the first phase will cater to vulnerable and priority groups in the population. It is expected that the vaccine will arrive in Jamaica by air, utilizing the transport system in place for countries participating in the COVAX Pan-American Health Organization PAHO's revolving fund facility. Dr. Tufton told the House that due to temperature sensitivity, the vaccines will be given special status by the ministry's personnel and customs officers at the airports. He noted that additional cold storage capacity will be required to meet needs at the central and parish levels. Dr. Tufton gave the assurance that the ministry is taking all the necessary steps to ensure that safe and effective vaccines are deployed. Meanwhile, the government is expected to spend $3 billion to implement Phase 1 of the coronavirus COVID-19 vaccine program. This was disclosed by the Minister of Health and Wellness, Dr. Christopher Tufton, during yesterday's sitting of the House of Representatives. He said that the sum covers, among other things, the purchase of the vaccines, supply chain and cold storage items, personal protective equipment, PPEs, transportation, staff costs including training, and public education and sensitization. Meanwhile, Dr. Tufton noted that acceptance and uptake for the approved COVID-19 vaccine in Jamaica is critical in slowing the spread of the infection, reducing morbidity and mortality, as well as rebuilding the economy. As such, he says that a robust public education and sensitization campaign will be implemented by the ministry aimed at increasing acceptance and uptake of the vaccine. Dr. Tufton noted that the purpose of the public education and sensitization campaign is to foster trust of the vaccine, dispel myths and misinformation, provide factual and accurate information about the vaccination, and gain public input in the vaccination strategies to be employed. Still making news tonight, the Ministry of Education, Youth and Information welcomes partnerships with private organizations on the One Laptop or Tablet Per Child initiative, and to this end, the Union Gardens and CareMed Foundations donated tablets valued at $2.8 million to students and teachers at the Union Gardens Infant and Evelyn Mitchell Infant Schools. Minister of Education, Youth and Information Fable Williams, in hailing private donors for their support of the One Laptop or Tablet Per Child initiative, said she is delighted with the contributions of cash and devices by organizations and individuals.
But we know that tablets and laptops, they're just the beginning step. It's just one piece of this puzzle. We know that we have to have connectivity, and you would have seen our efforts to have 100 schools connected using the satellite technology, and that's completed. And so teachers are able to go to those schools if they don't have connectivity at their homes and be able to use what's available at the school to reach the children who are online. Additionally, as schools come back face to face, we know that all our children will not be able to come back into the classroom. On any particular day, you may only have half of the class in the physical classroom, the other half at home. We're moving on all fronts. We know it's the content as well, and the ministry has a lot of content online that's available to our students. We know that it is teacher training of the platform, and we've done that and continue to do that with our teachers. We know that we also need to put in place a device management system, because we are going to have thousands of devices out there.
Meanwhile, the minister encouraged parents to get involved in their children's education, especially now as the COVID-19 virus presents challenges to the education system.
I want to encourage all our parents all across Jamaica, get involved with your children. Again, the studies show that when parents are involved with their children get better grades at school. I'm not making this up. You can go look at the many studies. Parenting is important in the home. And now, as we're going through the pandemic, we're calling on our parents even more and more to help their children, to help the education sector. I've said before, school is on. School 9 a.m. to 3 p.m., Monday to Friday. Don't send your children to the shop to go buy anything or have them doing housework. They need to be connected in some way, shape, or form with the education sector.
Principal of the Evelyn Mitchell Infant School, Shelley-Ann Coppershaw, in expressing gratitude for the tablets donated to the institution, pointed out the importance of teacher-parent partnerships in the successful education of each student.
Like other schools over the island, we face diverse challenges as we sought ways and means to diversify and reach out to our community in this unprecedented time. Internet connectivity cannot be overemphasized. Students without devices were many of the cries. Parents had to be using their phones for 2 or 3 students using the one phone in different schools. And of course, the data issue for teachers as well as parents was a major factor. However, we are pleased to report that parents collaborated with us with what device they had. And hence, we are able to engage approximately 70% of our students online, though adverse the circumstances. The number, however, fluctuated over the period as we faced various issues. In collaborating with the CareMed Foundation, we became optimistic when we learned that they would be coming on board to assist with the procuring of tablets for students and teachers. CareMed has been our chief sponsor over the years, and they have never failed to deliver. I use this medium to say kudos to you, Mr. Christian, and the CareMed team for the constant support that you have given us at the Evelyn Mitchell Infant School.
A teacher at the infant school, Sharice Bryan, spoke with us about how students are readjusting to face-to-face classes after the break due to the COVID-19 pandemic.
The students coming back face-to-face, it's quite a challenge actually. Even though I had anticipated it because most of them we weren't able to reach them due to the online setting that was just abruptly introduced to them. So them coming back was something that we had looked forward to. However, because of the long period of time that they had been out of the classroom, most of them had lost what they were taught. So it's like we are beginning at ground zero. We are just rebuilding. The rebuilding process had just started all over again. The online learning though, I am a bit happy for it. It's a happy, sad moment because even though these children are learning now how to manipulate a device and to become technological savvy so that they can be properly prepared for their age and time that they're embarking on. One of the challenges is that because they don't know how to fully use it, and their parents, they are the one who has to be guiding them, and they don't have the knowledge either. It has become a real challenge. So what we have to be doing, what we should have done, even though the time wasn't allotted to us, was to integrate it gradually, slowly, so that they could become one with it before this entire force down to say, this is the new way, you have to adapt to it, there's no other way.
Chairman of the Union Gardens and CareMed Foundation's Dr. Glenn Christian, in his remarks, noted that the coronavirus COVID-19 pandemic has presented an opportunity for greater private sector involvement in the education sector.
We need to develop long-term strategies to provide continued access to our students. This is not just a job for the Ministry of Education. It will require input from the entire society. One of the programs that companies are being urged to support is the one laptop or tablet per child initiative spearheaded by the ministry. I am pleased to report that through the Union Garden Foundation, we are donating $2 million to the Union Gardens Infant School for the purchase of tablets, while the CareMed Foundation, $800,000 has been donated to the Evelyn Mitchell Infant School in Clarendon. Minister, this COVID crisis presents an opportunity for us to focus on the long-term needs of the education system. As they say, never let a crisis go to waste. I believe this crisis presents a real opportunity for us to begin tackle some of the long-term needs of the education system and to bring the private sector on board in more public-private partnership. I am challenging and I'm calling on institutions like Chase and JSIF for us to continue the partnership to bring more state-of-the-art infant schools in place.
Still making Mello TV news tonight, the Ministry of Education, Youth and Information is advising that salaries for most teachers were not paid today because of a server error. The service provider had a significant challenge in processing the payroll for January 2020 as their main production server experienced significant technical difficulties that required time to fix. The ministry is working with the provider to have the error resolved and apologized for the inconvenience caused. Teachers are expected to receive the funds in their bank accounts by this Friday, January 22, 2021. Continuing with the news tonight, a man was fatally shot during a confrontation with the police in Mount Friendship, Stony Hill, St. Andrew yesterday. The deceased has been identified as 30-year-old Anthony Wildman, otherwise called Anthony Famous, of Main Street, Kingston 9. A Taurus .38 revolver, along with 2.38 rounds of ammunition, were seized. The matter has been reported to the Inspectorate and Professional Standards Oversight Bureau, IPROB, and the Independent Commission of Investigations, INDECOM. And those are some of the stories making news. We will now take a break and then join Christopher Scott with sports.